government says it is shocked at the current posture of the Ghana Medical Association, GMA, towards the implementation of the drone delivery health system after their association's General Secretary, Justice Yankson, supported its implementation. According to the Deputy Minister of Information, Justice Yankson was consulted during the early stages and he fully gave his blessing for the rollout of the drone system. The GMA Tuesday demanded the immediate suspension of the medical drones contract. The association, in a statement released shortly after Parliament approved the Drone for Medical Supply Service, said government failed to consult it. GMA President Dr. Frank Ankobia in the statement said the proposed services to be provided by the drones do not conform to the existing primary healthcare policy in the country, adding the use of the drones without the necessary improvement in human resource capacity will not benefit the country. Deputy General Secretary Titus Bayo spoke to Israel Aye on News Prime on Tuesday.
We haven't had full fix of what the state contract is all about. As an association, we made efforts to get access to this contract, study it, and even know what it's all about. And information has been high. But following the media discussion and the national discourse that occurred in a few weeks, we are of the opinion that, as based on the information, the planned implementation is at variance with our current health policy. The current health staff is such that we have health at primary care level, where we have the chiefs and then health centers. Big centers don't have doctors, and then staff who work there are not even trained to give blood. They cannot enter a field. They cannot make the critical decision that somebody blood. So how does this policy interplay affecting health policy? We have secondary level where we have district hospitals, where you can find doctors, where you can find doctor services, where blood can be transfused. Does that mean these books are going to deliver things to hospitals? Then the whole purpose of sending into the rural can also get defeated. So in our view, that we need to juxtapose the policy with our health legal system policy, the primary care policy of the country, and see where this system fits in before we talk about implementation.
But speaking at a press conference Wednesday morning, Deputy Minister of Information Pius Hajide called on all stakeholders in the health sector to support the drone system as it conforms to primary healthcare provision in Ghana.
The drone health delivery system is expected to cater for the distribution of essential medicine and drugs and blood to essentially our rural communities. Government is aware of the various feedbacks that have greeted the introduction of the technology, including that from the Ghana Medical Association. Indeed, at the 2018 Annual Health Summit in Accra, the Vice President Alhaji Dr. Mahmoud Baumia announced to the Ghana Medical Association government's intention to roll out the project as part of efforts to ensure effective healthcare delivery. The Ghana Medical Association welcomed the decision by government, and to quote the General Secretary of the GMA, Dr. Justice Yankson's reaction to the announcement, and I quote, "Well, as for us as an association, on countless occasions, we have bemoaned the state of emergency medical service in the country. So, if efforts are being made by the government to ensure that we strengthen that sector, we strengthen that aspect of our healthcare delivery, then we say kudos. Government is therefore taken aback at the current position of the GMA when it says, and I quote, The proposed services to be provided by the drones do not conform to the primary healthcare policy in Ghana. Ladies and gentlemen, the drone technology, like other technology introduced into the health delivery system, fits well into the primary healthcare policy towards the achievement of universal health coverage. Last week, I personally joined officials of the Ghana Health Service and Zipline Company Limited to outline details and engage the media on the creation of awareness. Government is committed to ensuring effective healthcare delivery in the country, especially in the rural areas, and we believe that the drone health delivery system will largely make an impact aside other measures to improve the health sector. Our doors remained open for further engagements and consultations on this project, which is to benefit the citizens of this country. The Akufo-Addo administration will continue to improve the healthcare system and services for the well-being of citizens.